Physical therapy patient engagement is one of the most important components of successful physical therapy outcomes. When patients are actively involved in their treatment, they're more likely to adhere to exercise programs, stay motivated, and achieve their rehabilitation goals. However, engaging patients isn't always straightforward, especially when dealing with complex conditions, pain, or other barriers to participation. Patient engagement goes beyond compliance. It includes the patient's active participation and emotional investment in their care. Engaged patients are more likely to adhere to prescribed exercises and therapy sessions, maintain a positive outlook on their recovery, communicate openly about challenges, allowing PTs to adjust treatment plans appropriately, and experience better clinical outcomes, including improved function and reduced pain. On the other hand, disengaged patients are at higher risk of dropping out of therapy, delaying progress, or even experiencing setbacks in their recovery. Understanding the common obstacles to patient engagement helps physical therapists address these challenges effectively. Lack of understanding or education. Patients often struggle to engage when they don't fully understand their condition, the purpose of therapy, or the benefits of prescribed exercises. Miscommunication or not enough education can lead to confusion and lowered motivation. Emotional and psychological factors. Anxiety, depression, fear of re-injury, or frustration with slow progress can create emotional barriers to engagement. Patients might feel overwhelmed or hopeless, especially when dealing with chronic pain or long-term injuries. Perceived lack of progress. When patients don't see immediate results, they may become discouraged or skeptical about the effectiveness of therapy. This is especially common with conditions requiring longer rehabilitation. Scheduling and lifestyle constraints. Busy schedules, family responsibilities, or limited transportation options can make it difficult for patients to attend therapy sessions consistently or complete home exercises. Here are several great physical therapy patient engagement strategies. Build strong patient-therapist relationships. The foundation of patient engagement involves establishing trust and rapport. Patients are more likely to engage when they feel understood, respected, and supported by their physical therapist. Building rapport involves active listening. Take time to understand the patient's concerns, goals, and preferences. Empathy and validation. Acknowledge their feelings and challenges without judgment. Open communication. Create a safe space for patients to express their fears, frustrations, or doubts. Educate patients effectively. Education is a powerful tool for fostering engagement. When patients understand their condition and the purpose of their therapy, they're more likely to stay motivated. Effective education techniques include: simplify complicated information. Use clear, non-technical language to explain diagnoses and treatment plans. Visual aids include diagrams, videos, or apps to demonstrate exercises or anatomy. Reinforce key points. Make sure important information is reiterated throughout the therapy process to improve retention. Involve patients in goal setting. Collaborate with patients to set achievable, personalized goals, making sure they understand how each step contributes to their recovery. Personalized treatment plans. A one-size-fits-all approach rarely works in physical therapy. Personalizing treatment plans based on the patient's individual needs, preferences, and lifestyle increases their sense of ownership and engagement. Adapt exercises. Tailor exercises to align with the patient's fitness level, interests, and pain tolerance. Incorporate patient preferences. Ask about activities they enjoy or functional goals they want to achieve, such as returning to sports or playing with their children. Consider cultural factors. Be mindful of cultural or religious considerations that might influence the patient's comfort with certain activities or interactions. Use technology to engage patients. Digital tools can improve engagement by making therapy more accessible and interactive. Recommended tools include home exercise apps. Apps or software can allow patients to access exercise instructions and track their progress from their mobile device. Telehealth. Virtual therapy sessions provide flexibility for patients with scheduling or transportation barriers. Wearable devices, devices like fitness trackers or pedometers, can motivate patients by tracking activity levels and providing real-time feedback. Celebrate small wins. Acknowledging progress, no matter how small, boosts patient morale and reinforces their commitment to therapy. Ways to celebrate with physical therapy patients include highlighting milestones. Point out improvements in strength, mobility, or pain levels, even if they seem minor. providing positive reinforcement. Use encouraging language to recognize their efforts. Visualizing progress charts. Show patients their progress over time through objective data like range of motion or weight-bearing ability. Address emotional and psychological barriers. Many patients face emotional challenges that lower their engagement. PTs can play a supportive role by addressing these barriers with compassion and practical strategies. Consider approaches like mindfulness techniques, introduce breathing exercises or mindfulness practices to help patients manage stress or fear. Motivational interviewing. Use this patient-centered technique to explore their motivations and address concerns or questions about therapy. Collaborate with mental health professionals. If a patient is struggling with a lot of emotional distress, consider referring them to a counselor or psychologist for additional support. Make therapy fun and interactive. Engaging patients through enjoyable, interactive sessions can make a big difference in their commitment to therapy. Interactive therapy ideas include gamify exercises. Turn exercises into challenges or games to make them more enjoyable. Incorporate social interaction. Pair patients with similar goals for group exercises or introduce family members into sessions for support if appropriate. Switch up the routine. Keep sessions interesting by introducing new activities or tools regularly. Be flexible and accommodating. Meeting patients where they are, both physically and emotionally, is key for building engagement. Flexible strategies include adjust scheduling. Offer evening or weekend appointments for patients with busy schedules if possible. Adapt home exercise plans. Modify exercises to fit the patient's available time, space, and resources. Provide alternative solutions. Offer telehealth or in-home visits for patients with transportation challenges. Tracking patient engagement is a great way to identify areas for improvement and keep up motivation throughout the therapy process. Tools for measuring engagement include patient feedback surveys. Regularly ask patients about their experience and any barriers they're facing. Progress metrics. Use objective measures like strength gains or pain reduction to evaluate adherence. Home exercise logs. Encourage patients to track their progress and bring logs to sessions for review. Tips for sustaining engagement include frequent check-ins. Regularly assess how patients are feeling about their progress and therapy plan. Adjust goals as needed. Modify goals to ensure they remain relevant and achievable. Celebrate long-term success. Recognize patients' achievements at the conclusion of therapy, emphasizing the skills and strategies they've built to maintain their health. Engaging patients is a very important aspect of successful physical therapy, and it requires a multifaceted approach. By building strong relationships, educating properly, personalizing care, and leveraging technology, physical therapists can encourage greater commitment and motivation from their patients.